Hello, and welcome to your Integrated Home Care Services training module on filling out a UB04 Claims Form. In today's training, we will be covering the proper steps on how to submit an institutional or UB04 claim form in an attempt to help assist you as a network provider in submitting your claims without any issues. Before we jump in, please be advised that there are two types of claim forms. There is a UB04 form or institutional claim form, and there is a CMS 1500 form or professional claim form. The one that you will be using will depend on the healthcare plan or payer you are working with. If you have any doubts as to what form to use, please refer to your guidelines and/or contract. It's important to note, Medicare institutional claims requires HIPS and hospice Q codes, whereas commercial claims do not require these codes. Home health services covered by Medicare and commercial insurers must be billed using the UB04 Claim Form. All DME, home infusion, and Medicaid home health claims must be submitted using the CMS 1500 Claim Form. So let's begin. Section 1. Enter your agency address. Section 2. Additional space available for agency address inputting and/or can be left in blank. Always assure you are entering the zip code plus the USPS Postal Service code. Section 3 is the patient's control number, which is the patient account number. Patient control numbers should be generated by the servicing agency to keep a track record of a patient's service and billing history. Section 4 is the bill type. Very important. This depends on the type of provider and services you render, so please assure you enter the correct corresponding bill type. Generally, for home health agencies, bill code type used is 322 on all original claims. Bill code type 327 if you are identifying a corrected claim, and bill code type 329 on all final claims. Section 5. Enter your agency's federal tax ID, also known as the TIN number. Section 6. Statement covers period. This is the period of the claim you are filing for, and must correspond with the dates of service. Section 7 is generally left in blank. Section 8A is the patient ID number. Section 8B is the patient's first and last name. Section 9A is the patient's address. Section 9B is the patient's city in which they reside. Section 9C is the patient's state in which they reside. Section 9D is the patient's zip code +4 in which they reside. Section 10 is the patient's date of birth in numerical form using 2 digits for the month, 2 digits for the day, and 4 digits for the year. Section 11 is the patient's identifying gender. Sections 12, 13, 14, and 15 fall under the admissions category. Section 12 being the admission start date of when you first began rendering your services. Section 13, please defer to the proper code usage in your billing and claims guidelines. Section 14, for the type of admission, again, please defer to the proper codes usage in your billing and claims guidelines. Section 15, for the admission source, again, please defer to the proper code usage in your billing and claims guidelines. Section 16 can be left in blank. Section 17 for stat, please check for proper reference code depending on your agency services. Sections 18 through sections 30 are generally left in blank and primarily used by hospital facilities, which may not pertain to a service provider. Section 31, you will enter the occurrence code and occurrence date. Sections 32 through 37 are generally left in blank and primarily used by the hospital facilities, which may not pertain to a service provider. Section 38, you will re-enter the patient's first and last name, including their mailing address. Don't forget the zip code +4, the USPS Postal Service digits. Sections 39, 40, and 41 are available to enter value codes and amounts. Please note that value codes 61 and 85 are both required with the corresponding value code amounts. Sections 42, 43, and 44 are joint sections. On Section 42, you will be listing the revenue codes for the services that were rendered to the patient. On Section 43, you will be listing the code description. Please assure you are entering the correct code. These code descriptions can be located on your authorization generated by your contracted third-party administrator. Section 44, you will be entering the corresponding HCPCS code, also known as the Healthcare Common Procedure Coding System. Section 45, you will enter the beginning and end date of when the services were rendered. Please defer to the authorization date parameters on your authorization. Section 46, the number of units rendered for the episode you are filing your claim for. Please refer to your authorization for this information. Section 47, the total charges you are filing for. Section 48, non-covered charges for services you rendered and are filing for on your claim. Section 49 is generally left in blank. Section 50, payer and/or healthcare plan name and full address. Section 51, you will be entering the health plan ID, also known as the payer ID. Please refer to your contract to obtain the correct payer ID. Entering the wrong payer ID will result in a denial and/or a rejection. Section 52 is a release of information which will be tagged as Y for yes or N for no. Section 53 is the assignment of benefits, which will be tagged as Y for yes or N for no. Section 54, prior payments. Enter whether or not you have received prior payments for this claim. Section 55, you will enter the total amount being submitted on the claim. Section 56, enter your agency NPI number. Please note, if you are an agency operating under multiple NPIs under the same tax ID, you must enter the correct NPI location, which is the exact servicing location within your agency that provided the services to the patient on the claim. You can find the servicing NPI location number on your authorization. Section 57, other agency identifying ID numbers. Here you will enter your taxonomy code, the specialty code and the type of service your agency provides. Section 58, patient first and last name or insurer's name. Section 59, enter the corresponding code for the patient's relationship. Please refer to your billing and claims guidelines for proper code usage. Section 60, enter the patient's ID number. Sections 61 through 65 are generally left in blank, but provide you with the ability to enter the following information if applicable. Section 61, the group name for the payer. Section 62, the insurance group ID. Section 63, treatment authorization codes, also known as your authorization number. If you are a home health agency, your authorization number will begin with an H and a dash. Section 64, document control number is used when filing for a corrected claim. Here you must enter the original claim number if and when you are filing a corrected claim. Section 65, patient's employer name if applicable. Section 66, you will enter the patient's diagnosis code, which can also be found on your authorization or your referral documents provided by the primary care physician. Section 67 is non-existent. Section 68, continuation of diagnosis codes if applicable. Section 69 is the admission diagnosis, also known as the primary diagnosis if the patient was originally hospitalized. Section 70, patient reason diagnosis code if applicable. Section 71, patient PPS code if applicable. Sections 72 and 73, you will enter the ECI codes if applicable. However, these sections are generally left in blank. Section 74, with boxes A through E, are for the principal procedure codes, along with the date if applicable. Section 75, left in blank. Sections 76 through 79, you will enter the ordering physician's information, including the ordering physician's MPI number. Section 80 is the remarks section. However, this section is generally left in blank. And Section 81, boxes A through D, are available to enter claim codes, but is generally left in blank. Once you complete your UB04 claim form, always double check for any errors. Once revised, you're going to submit it to the clearinghouse. A simple rule of thumb is 2 to 3 sets of eyes is better than 1. The biggest problem with billing is that providers or agencies don't know where to find all the data and where to add it on the claim. That's why most claims are rejected or denied. So if you have any problems with your billing or any doubts, or if you need help, you can contact us here at Integrated Home Care Services. Reach us at providerservices@ihcscorp.com or call us at 844-215-4264, option 4. Thanks for watching. Catch you on our next video.